My name is Chris Garcia Wild. I work over at Mount Sinai. I'm an internal medicine pediatrics resident. And today we're going to talk about some of the symptoms of difficulty breathing. And we're going to look at some examples so that you all have the useful tools to be able to recognize these symptoms at home or in the community and know when to go to the doctor or to the hospital. So we're going to be watching some real videos of real patients. And then the second half of the talk will be a little bit more about home remedies that you can use to try to address these symptoms and some tools, mainly the pulse oximeter. The main objectives for today's meeting, we're going to review these signs of difficulty breathing. You'll identify some of them. We'll talk about when to go to the hospital. We'll review the pulse oximeter again, and then we'll talk about home remedies for respiratory symptoms. On the left is a cartoon version before we get into some real life videos, and we'll be looking for some of these signs that you see in the cartoon. These are signs that your body's really working hard to breathe. One of them here is the skin tugging in the trachea. Over here, you can see the skin pulling between the ribs, and then here you see the nose opening really wide to pull in air. These are some of the things I want you to look out for when we watch the video in a second. With that being said, I wanted to warn everybody, these videos can be scary for some people. You may have seen loved ones with difficulty breathing, or you even yourself may have experienced this before. So we'll start with adults. This gentleman is a patient who is having some difficulty breathing, and we're going to watch some of his symptoms. The first one is just how fast he's breathing. You can see that he's taking in a lot of breaths every other second, basically. And you can see a lot of his muscles are being used. His neck muscles, his shoulders, and even his jaw are all pulling up to try to pull air in. You can also see his stomach here is really working to breathe. His stomach goes up and down. Those are signs that somebody's really struggling to breathe. If you see that at home, definitely have to call the ambulance. Another one is nasal flaring. You'll see the nose kind of getting wider to pull more air in. This is an example we saw in the other picture of the skin pulling in on top of your sternum. Here you can see the skin kind of pulling in under the rib and between the ribs. And then here are some of those neck muscles and back muscles kind of pulling in to breathe more. Sometimes when people are working really hard to breathe, they'll start to sweat. And when you touch them, they may feel cold. That's a bad sign that they're working too hard to breathe. Eventually, you may get tired and then may not get enough oxygen, and your skin can actually turn blue. Usually it starts around the lips and the tips of your fingers and toes. At that point, it's already an emergency and you need to call 911. And then after a lot of time breathing this hard, you can get a headache. That's another symptom. And then if the patient, of course, has a change in their ability to think or speak, if they're kind of confused, these are all signs that they're really struggling to breathe and you need to get help. So that's the first video. This one, I just wanted you to see another angle of the patient breathing very quickly. You can see his chest going up and down pretty fast. At home, you can actually count how fast people are breathing. And if you notice an adult doing this for 30 times or more in a minute, definitely a sign to go to the doctor. You can set a timer and just watch. Every time the chest goes up will count as one breath. This one, I'm going to play sound for it just so that you can hear what it's like when somebody's coughing nonstop. And this is also a sign that you need to go to the hospital. At this point, we're concerned you can't breathe because you're coughing so much and not able to eat or drink. I think you can get the point just from that brief part of the video. Basically, the patient's coughing so much that he's really struggling to breathe. The majority of his time is coughing and not really inhaling. And as you can imagine, you can't really eat or hydrate that way. So if you see something like that in your loved one, call the ambulance or go to the nearest hospital. We're going to watch a video of some of these breathing difficulty signs in children. Some of them are similar to what you'll see in adults. The first one here, the same thing. The skin gets pulled in underneath the ribs when the baby's really trying hard to pull air into the lungs. You'll see that belly bouncing. Here you'll see the skin pulling in between the ribs or underneath the ribs. Here you can count the breaths again. And for kids, it's normal to breathe faster than adults. But if they're breathing this fast, then you'll realize it's abnormal, atypical for what you usually see. Here you'll see the skin again pulling in, and then the nose doing the flaring where they get big nostrils to pull in air. And in very severe cases, you'll see them shaking their head up and down. All of these are red flags that the child is having difficulty breathing and you should go see the doctor. And these are just some pictures. This is the skin tugging again. This is the blue skin, which is a sign they don't have enough oxygen. And then these are the flared nostrils. So we reviewed some of the real human videos of people with difficulty breathing. We're going to talk about when to go to the hospital. So some of you all may already know these signs, but it's always important to review because you never know what can happen. If you or your loved one develops any of these symptoms on the left that are listed here, then it's a sign that you need to go to the hospital. So the first one is rapid breathing, like in the video we watched. The second one is about confusion. If they're no longer making sense, if they don't know where they are or who you are, or if their memory is abnormal, then they need to be evaluated. If their nose is flaring, if they're so out of breath they can't speak a sentence, if the pulse oximeter again is less than 90%, or in people who have COPD, 88%. If it's persistently less than that, then it's a sign you should be evaluated by a doctor. If you have chest pain, your heart is skipping beats, if you're fainting or dizzy, and then of course, if your loved one is not able to speak clearly or weak all of a sudden, then they need to be evaluated. And then lastly, if you're not urinating, voiding as much as usual, that's a sign of dehydration. In children, especially if they void less than 3 times a day, less than 3 wet diapers, or just 3 urine events per day, then we get concerned that they're dehydrated. So they should be evaluated. And just a reminder, an automatic trip to the hospital is if any infant under 2 months old becomes febrile. If they have a fever, you go straight to the hospital. And the concern is that they may have an infection in the brain or the spinal column. Just to review the pulse oximeter, this is a great tool to help people at home measure their own oxygen in the blood. You put this device on your finger and it'll give you 2 numbers. The top number here where you see SpO2, that's your oxygen saturation. This is the number that we want ideally when you're resting to be above 90 in adults, and in children usually above 94. If you have a condition like COPD, then you may notice it to be around 88, 89, 90 at home. And if you're actually on oxygen at home because of COPD, then you'll be adjusting your oxygen to try to get to that goal. The other number on the pulse oximeter is your heart rate. That's pulse rate or PR, beats per minute. Here you'll see it's 66. In adults, normal is between 60 and 100. Above that, you're concerned that the heart is beating very fast for some reason, which may be because of shortness of breath or you're very sick. Now, if it's above 100 because you just went for a walk or you climbed the stairs, then you should relax for 5 minutes and then check it again. Keep it steady on your finger for 30 seconds to a minute. Make sure your finger is clean, and then you can interpret the numbers. If you just put it on your finger really quickly and look, it may not be an accurate reading. So take your time with the pulse oximeter. There is no rush with it. A reminder, people with COPD can have a lower oxygen level, and 88% can be acceptable at home. And then a brief drop in oxygen for a few minutes is normal, especially if you just were walking around or doing exercise. Just take a seat and then remeasure it. All of these numbers on the pulse oximeter have to be interpreted with the symptoms that you have. So if you're not having any symptoms, then it may not be important to even look at your pulse oximeter if you feel great. But if you're having symptoms and your pulse oximeter is giving you some red flags, maybe your oxygen is normal but on the lower side of normal, if you still see these symptoms that we reviewed earlier, you should still go to the hospital. So this isn't really a tool to tell you not to go to the hospital. It's just more evidence to help you know how sick you are. And finally, a few home remedies. A lot of folks respond well to these things at home, and there are a lot of household items that you can use to feel better without having to go to the pharmacy and pay money for some of these over-the-counter cough and flu medications. The first home remedy that I usually recommend is honey, especially for cough. Remember, this has to be in older infants and adults. You can't give honey to any infants under a year old or babies. But for older folks, we recommend a tablespoon of honey with tea, usually at bedtime, and honey actually calms the throat so you don't have as much triggering of your cough. Some people also benefit from raising the back of the bed or putting some pillows under the mattress to incline your body so that if you have congestion in your nose, it goes down your throat instead of into your windpipe. So just incline your body when you're sleeping and you may cough less. As far as congestion, one of the easiest tricks at home is to use steam to loosen your mucus. The vapor from the water can help make your boogers easier to come out, and this works for children and adults. So the way you can do it is either by boiling boiling water or by standing in a hot shower. You don't have to stand in the actual shower. You stand in the bathroom with the shower turned on hot, wait for the room to fill with steam, and then you can sit in there for 10 to 15 minutes, taking deep breaths to inhale the steam and hydrate your lungs. The other way to do it is a little bit more involved. You have to boil water and then inhale the steam over the boiling water. You have to be very careful with that method. So I usually recommend standing in the bathroom with a hot shower on. And then the last couple of remedies for sore throat, just a warm tea with lemon can help relax the throat. And then gargling salt water can also calm down the throat. When you have irritation, whether it's from coughing or an infection, these things will help hydrate your throat so that it doesn't feel as raw and stinging when you swallow or eat or drink things. So these are a few home remedies. There are a lot more that you can look up or talk about with your provider, but always have these tricks up your sleeve just in case you have some symptoms at home. These are just visuals of the things we just talked about: the lemon and honey, the salt and water, steam, and then incline your bed. Some people also use a humidifier, but those are a little bit more costly. So if you have boiling water or a hot shower, you can just replace the humidifier. So this is my clinic where I work at. If you don't have a primary care provider, we're happy to see you at our clinic on 106th and 3rd. Give us a phone call. Ask to make an appointment. This is my card if you want to make an appointment with me. I see any age, children and adults. And then some reminders. Remember, if you have symptoms of long COVID, they can include anything from all of these things on the right: coughing, loss of smell, difficulty sleeping, insomnia. We want you to reach out to a healthcare provider to talk about it. So you can scan this QR code and try to visit a long COVID clinic. These symptoms would present after having a COVID infection. And then maybe the most important slide is about vaccines. Vaccines save lives. They prevent a lot of the symptoms that we talked about by giving your immune system the strength and the memory of these infections so that when your body faces the flu, it's already ready to fight. Make sure you get your flu shot every flu season, every year. Make sure you're up to date on your COVID shots. Everybody over 6 months old should be getting their COVID shots and their boosters. Talk to your doctor to see if you're due for one. RSV shot, highly recommended as well. RSV is another infection of the lungs that can make you very sick. And then the pneumonia vaccines. That one is highly recommended for people over the age of 19 who have certain conditions that your doctor can help you clarify. Or if you're over the age of 65, everybody gets the pneumococcal vaccine. If you're not up to date on your vaccines, reach out to your doctor or come to our clinic.